Caroline Jones.
Diolch, Llywydd. Cabinet Secretary, despite hearing evidence in our committee about winter pressures and how they impact upon the NHS in Wales, we never seem to learn from these experiences. We always seem to be caught on the hop, as though winter pressure was something new. The word unprecedented appears to come out every time, as if this word excuses the very fact that we are not learning from past experiences. The additional £10 is, of course, welcome, but I want to ask you, Cabinet Secretary, how was the £50 million spent in combating this situation, which happens almost at this time every year? What lessons, year on year, regarding winter pressures are being learned, and how are they being acted upon? We hear again that flu outbreaks have added to the pressure, which of course they would. But again, flu is not new to our country at this time of the year. We expect it. It gets colder, and flu to be partly a consequence of this. It happens the same time every year, and we must be prepared for this. The Royal College of Emergency Medicine stated that emergency departments in Welsh hospitals felt like a battlefield to staff. We know that A&E attendances topped 1 million. But why, when we are encouraging people to use pharmacies, for example, are they still turning up to A&E? Is this because they cannot get the GP appointments that they feel they need, and that A&E is now becoming the alternative? What discussions will you be having with both primary care and secondary care staff to gain an insight into the situation we find ourselves in? What proportion of these A&E admissions could have been dealt with by other means, such as pharmacy and GP visits? Were the hospital staff in these departments prepared and of full complement? You state that NHS organisations have been planning for this period since the end of last winter, supported by the £50 million of funding to help them balance urgent and planned care activity. Yet we do not still have sufficient beds or staff to cope with this situation. How can we plan for next year so that we are not cancelling operations for patients, which could lead to them needing additional treatment because of this delay, which has a knock-on effect on cost, of course, because they cost more in the long run, or they possibly could. What strategy do you have planned?
I think you've already outlined enough questions for the Minister. I don't know if you'll be able to remember them now.
Sorry, so that all GPs and hospital staff can meet to combat this. Thank you.
Thank you for the series of detailed questions. I appreciate we only have 20 minutes on the agenda for the 3 questions. I'll try and be brief in response. The questions about the money and the broader look back to winter this year to try and learn for the next year, I think I dealt with in response to Angela Burns. There's a question for the government, but also for the health service, together with government, but also housing colleagues as well, and understanding what we've done this year, what more we need to do in years to come as we progressively design and deliver a more integrated system that understands the needs of the citizen and how we deal with. And that does come on to, I thought, perhaps the most interesting part of your series of questions was actually about how the public can be part of this as well. This isn't about blaming the public, but it's about how do we equip the public to make different choices and how do we make sure those choices are available. So the Choose Well campaign encouraged people to think differently. And just before Christmas, we saw the ambulance service producing a list of calls they'd had for coughs and colds and shoulder pain that weren't 999 calls at all. So that is a real part of our system, but actually we need to manage demand differently and to change expectations around that. And actually the investment we're making in pharmacy is a good example of wanting to do that. I expect that in the lessons to be learned during this winter and from the end of this winter, we won't just have a report and a dry report for operational managers. We'll have to take account of the real experience of staff in every part of our system to then try and plan ahead for not just the year to come, but in the response to the parliamentary review for the medium and longer term challenges that all of us face as our country changes, but as demand goes up. And as we all know, as money is tighter and the health and social care systems have less money than before, together with other public services, to manage an ever-increasing amount of demand.
Diolch i'r ysgrifennydd.
Thank you, Cabinet Secretary. The next